How does Wegovy help in weight loss? How does Wegovy help in weight loss? Wegovy is a GLP-1 receptor agonist. It works in three main places in the body. First, the brain. Wegovy acts on appetite-controlling centers in the hypothalamus. It reduces hunger and increases the feeling of fullness. As a result, you feel satisfied with smaller meals and have fewer food cravings. Second, the stomach. Wegovy slows gastric emptying. This means food stays longer in the stomach, helping you feel full for a longer time and reducing calorie intake. Third, the pancreas. Wegovy increases insulin secretion and reduces glucagon release. This improves blood sugar control and supports healthy metabolism. Wegovy is given as a once-weekly injection under the skin. It is administered subcutaneously, commonly in the abdomen, thigh, or upper arm. The active drug in Wegovy is semaglutide. Semaglutide is a long-acting GLP-1 receptor agonist. GLP-1 stands for glucagon-like peptide 1, a natural incretin hormone released from intestinal L cells after meals. Natural GLP-1 is quickly broken down by the DPP-4 enzyme. Semaglutide is specially modified to resist this enzyme, giving it a long half-life of about 1 week. That's why Wegovy is given only once weekly. At the receptor level, semaglutide binds to GLP-1 receptors, which are G-protein-coupled receptors. Activation of these receptors increases cyclic AMP inside cells, activates protein kinase A, and leads to hormone release and neuronal signaling. In the pancreas, semaglutide increases insulin secretion from beta cells, but only when blood glucose levels are high. This glucose-dependent action reduces the risk of hypoglycemia. It also suppresses glucagon release from alpha cells, reducing glucose production by the liver and improving overall glycemic control. In the brain, which is the most important site for weight loss, semaglutide activates satiety neurons and inhibits hunger-promoting neurons. It reduces food cravings and reward-based eating. As a result, the patient feels less hungry, feels full with smaller meals, and has less urge to snack. In the gastrointestinal tract, semaglutide slows gastric emptying, prolongs post-meal fullness, and leads to reduced meal size and calorie intake. Additional benefits include improved insulin sensitivity, reduction in body fat, mild lowering of blood pressure, and cardioprotective effects, especially in diabetic patients. In summary, appetite decreases, gastric emptying slows, insulin increases in a glucose-dependent manner, and glucagon decreases. This results in reduced calorie intake, improved glucose metabolism, and sustained weight loss. For more medical and pharmacology content, subscribe to Zen Med Space.